Hi, my name is Greg Kopp. I'm the instructor for Advanced Dynamic Anatomy with Great Lakes Seminars. Today I'm going to be going over how to find and release the serratus posterior superior muscle. Now this is a muscle that wasn't gone over in anatomy for a lot of people, but it's a really important muscle clinically. It's an important muscle clinically because it's a secondary inspiration muscle located in the upper mid-thoracic spine. And when it goes into spasm, it creates this really deep, intense ache in the mid-thoracic spine, upper thoracic spine region. And so that's a common complaint in patients, and therapists commonly treat the ribs in the thoracic spine, which is all correct, but they forget that a common source of that pain is a spasm of the serratus posterior superior. So to find that muscle, what you're going to do is you're first going to locate and kind of outline the T2 through T5 region with your hand. Right now I have my thumb on about T1, T2, and my index finger at around T5. The muscle itself runs lateral with a slightly downward angle in this direction. You want to be palpation-wise between the medial border of the scapula and the transverse processes of the spine. So in order to open that window up a little wider, I'm going to have Christina put her arm off the side of the table to abduct the scapula. So I'm going to find the gap between the medial border of the scapula and transverse processes. I'm going to overlap one finger on top of the other finger, and I'm simply going to go very, very deep because you're going through the mid-trap and the rhomboids. So it's a layer 3 muscle. And what you're feeling for are little tiny thread-like spasms in the serratus posterior superior. It feels very different from a mid-trap and a rhomboid because they are so thin. You do have to go fairly deep. And once you find it, you simply sit there and hold your pressure until you feel the muscle release, and the patient feels awesome after.